In conclusion, as we advance our discussion on operational habits, this slide brings us back to the psychological foundation of patient-centered care, the mechanics of trust. When you strip away the complex data and regulatory language, patient satisfaction and risk mitigation come down to meeting basic human expectations. First, patients want and expect their health information to be kept completely confidential. In our modern, highly digitized healthcare landscape, protecting patient data isn't just about checking a box for HIPAA or cybersecurity audits. Privacy is the absolute baseline of our relationship with the patient. The moment a patient feels their intimate health, details are handled carelessly, the therapeutic alliance fractures, and our institutional credibility vanishes. Second, patients deeply expect healthcare professionals to show genuine concern, warmth, and a willingness to actively listen and answer questions. Patients do not view healthcare as a purely transactional service. When people are sick, injured, or vulnerable, they need to feel safe. If a clinician rushes through an examination, cuts off a patient's questions, or comes across as detached, the patient feels dismissed. Empathy and active listening are not optional soft skills. They are critical clinical tools that directly impact patient outcomes. This brings us to our final, most critical point for risk management. A lack of trust is the true root of many medical professional liability lawsuits. This is a vital piece of data for our leadership team to internalize. Patients rarely sue a facility simply because a bad clinical outcome occurred. Medicine is inherently risky, and complications happen. Instead, patients sue when a bad outcome is combined with an aloof attitude, a failure to communicate, or a lack of transparency. They sue because they feel lied to, ignored, or stonewalled. When we invest in privacy, deliver care with genuine warmth, and communicate openly, we don't just elevate our patient satisfaction scores, we construct our most powerful natural barrier against legal liability. Now that we have covered these fundamental steps, please continue forward and watch the videos in this course, which will take a closer look at these core concepts and break down the specific clinical information you need to know for best practice and understanding.